Hi there, Dr. Lavan. So today our quick medical life hack is about exercise, but more importantly, weight training exercise, which actually has benefits for us later as we get older. So we all know the benefits of exercise. Exercise can reduce our risk of diabetes, developing blood pressure, and for those who've actually got high blood pressure, it can actually help in dropping that down by dropping things like cholesterol as well as weight. Now with exercise particularly, we have lots of patients who do the recommended guidelines, which is about 150 minutes every week, but they do it at quite a slow pace. Now what we normally encourage those patients is to try and do a brisk walk or more of a run or a jog. The reason for this is by increasing that heart rate, we're actually seeing the heart being stressed a little bit further and therefore improving our cardiovascular system, and that's our heart with our blood vessels. Now what's important now for us as we get older is actually trying to do weight training exercises. So typically we would have thought of those patients who were very young, who want to get a better physique, better tone, looking good, obviously helping with the mental health. However, we are finding now that if we start very early and start improving our muscle strength and our core muscles by doing exercise involving weights, we are actually improving bone strength. Now this is unusual, but this is actually done by strengthening the muscles, which will then put a strain or stress on those bones. By straining and stressing those bones and then de-stressing and straining again, we are finding that these bones are becoming stronger over time, and the body is actually telling those areas, look, let's release more chemicals, let's release more vitamin D and calcium into this area to strengthen our bones. And what we do find, if we start early in our teens and then older than that, we should be able to see much stronger bones as we're older. So therefore, when we are in the older generations, we are finding those patients are walking more with stability, they're having a reduced risk of falls, but more importantly, if the worst were to happen and they did have a fall, their risk of gaining a fracture is much more decreased. Now it's also important to remember in females, especially after the stage of menopause, that can typically increase in terms of the risk of fractures. So it's really important, especially with the females, but also men and women altogether, before this period and as young as possible, to actually do our exercises as we've been told, but also do it with a little bit of muscle strengthening, which will thereby improve our bone strength. So your life hack today is about exercise and actually improving our muscle and bone strength by doing these exercises can actually reduce our risk of fractures and falls when we're older. Thank you very much.